if feed intake does not meet the energy demand, there will be insufficient terminal production of propionic acid, which is a precursor of glucose. If glucose is not enough, if propionic acid is insufficient, glucose will be insufficient. If glucose will be insufficient, hypoglycemia will be there, means low blood sugar will be there. If low blood sugar is there, that will metabolize the fatty acid and glycerol supplies. Then what happens? The fatty acid and glycerol, that will oxidize to form acetyl coenzyme A. And if there is excess of acetyl coenzyme A, what will happen? It happens due to lack of energy. If there is lack of energy, excess of acetyl coenzyme will be produced. It is converted to ketone bodies, and that result in ketosis. That is a major metabolic disease that we can find. So ketone bodies will accumulate and excreted in milk and urine. This is the case. This is just how ketosis occurs. Here again, I am repeating, if the feed intake does not meet energy demand, if energy is not fulfilled, what will happen? Propionic acid will be produced less. If propionic acid is produced less, it is a precursor of glucose, so glucose will be produced less. If glucose is less, it will be hypoglycemic. Low blood sugar will be there. If blood sugar is less, then it will metabolize fatty acid and glycerol. If fatty acid and glycerol, then this will be converted to acetyl coenzyme A, and acetyl coenzyme A will be converted to, if it comes in excess, it will be converted to ketone bodies, and they will lead to ketosis. Ketone bodies will be accumulated and excreted in milk and urine. So liver is not able to cope up if there is lack of energy. Thank you.